Well, welcome everybody to this press conference. Thank you for joining us today. I want to introduce, I've got a few people with me. I have Dr. Michelle Nace is with me today. She is with Foundation Health Partners and a pediatrician in Fairbanks. She is the lead spokesperson for the school district's medical advisory committee. And we work closely with Dr. Nace and others on the committee, also Dr. Claire Stoltz and the public health nurse, Danette, whose name I'm just not remembering at the last, Danette Marks. And anyway, so we work closely with our medical advisory committee, of course, with everything, all of our health and safety protocols this year. And so happy that Dr. Nace is here. And then also I have with me Mr. Luke Meinert, who is Assistant Superintendent of Secondary Schools and works directly with high schools and sports and activities. And so just another resource for today. So I'll start by reading a statement, and then I'll turn it over to Dr. Nace, and then we will open it up to questions. So yesterday afternoon, the school district was made aware that a student athlete tested positive for COVID-19. That student played in Saturday evening's football game between Lathrop and West Valley High Schools. So following all CDC and DHSS guidelines, all athletes, coaching staff, and other individuals who were likely in close contact with the case positive student have been notified to self-quarantine for 14 days. The CDC and DHSS define close contact for COVID-19 as someone who has interacted with a case positive person within 6 feet for a cumulative duration of 15 minutes. So all of the individuals in quarantine are asked to monitor for symptoms and to contact their healthcare provider if they become symptomatic. Our school nurses and administration will be following up also with each family and each person involved in that game for follow-up conversations. Additional quarantine or isolation times will be determined on a case-by-case basis. Public health, again, through our medical advisory committee, and in any instance of a positive case, of course, we will directly contact public health. They've been notified, and they will coordinate with the district to conduct contact tracing. Persons who were not in close contact with a confirmed case positive person are considered a contact of a contact, and so they are not required to self-quarantine. So if folks have questions about that, again, Dr. Nace will talk about that a little bit. If folks have questions about that, we encourage them to call the school nurse and kind of talk through that a little bit, and we can provide more information as well. The best thing we can all do to mitigate the spread of the COVID virus is to use all the safety protocols that we have in place in our school district. So that's wearing a mask, maintaining social distancing of 6 feet or more, maintaining personal bubbles, and washing your hands. So this situation is why we follow the CDC health guidelines and safety protocols in our district facilities. We also ask parents, again, not to send students to practice or other activities if they're feeling ill. And right now, Fairbanks is fully in remote learning, so we do not have kids in classrooms or in schools right now, but we do have activities. Our fall sports are running, of course. So if a student, if your child or somebody you care for becomes ill, please don't send them to practice, don't send them to an activity, and contact your healthcare provider. At this time, the football in Fairbanks will continue in the district, and our other high schools will continue to follow current safety protocols. So with that, I will turn it over to Dr. Michelle Nace, again with Foundation Health Partners. I think you're on mute, Dr. Nace.
I'm Michelle Nace, and I've been working in partnership with the school district to kind of help mitigate as we have this difficult time of managing both the virus and the safety of the community and students, as well as having the goal of getting kids back into learning and getting them back into their routines, which they knew from last year. One thing I wanted to bring up about is the concept of quarantine. When people hear that there's been a positive case with a student, it can create some anxiety within the community, especially people who may or think they've had contact. So I wanted to talk about about what quarantine means. And those individuals in quarantine as a result of being a close contact, as mentioned, they do not need to be tested universally unless they have or develop symptoms of COVID-19. So if they do develop symptoms, then that they should reach out by phone and call to get and find out what the next best step, whether they need to be seen or can be directly tested. If they are directed by public health to be tested or the healthcare provider, then yes, they should be tested. But getting tested now and having a negative test does not shorten the required 14-day quarantine period. They still need to be quarantined for the entire 14 days. And this time period is to allow to see if they develop symptoms. So by getting a test, having it be negative does not shorten that 14-day time period. And in quarantine, the purpose of it is it's a public health measure used to limit the spread of the disease. And that's what we're trying to do, is to mitigate those. So we're asking those individuals to voluntarily quarantine and stay at home. And then to assist public health with figuring out the contact tracing of what other connections there may or may not have been, so that we can help keep our community safe. I realize, again, this is a difficult time period, can be very stressful. If you do have questions, if you are concerned about your health, if you do develop symptoms, you should reach out to your primary care provider. Thank you.
Okay, thanks. And with that, we will open it up to questions. And I know we have, so Jordan, is Jordan on? Jordan has a couple questions.
Yes, and I'll just start in with the current health status of the student athlete and what prompted the test, whether it was symptoms or contact tracing through that.
So actually, we're not going to release any info about the student in particular. How the case came to us is that the family reached out and indicated that they had the student get a test and that test was positive. And so that at this time, that's what we'll release to the public.
I'll allow anyone else to have a question.
Okay.
Yeah.
I see Gilbert from Cordova is on. Did you have a question? And then I also see Dan Bross from KUAC. Let's see, it looks like Dan, so Dan is asking, how much do you see this as a sign of what's to come in terms of cases? I'll actually ask Dr. Nace to respond to that, because she is directly connected to, you know, again, our whole community, and we're watching case rates as an entire community.
So the question is how do we see this as a sign of what's to come in terms of cases and case number? And I would put out again, this is a tricky virus. We don't know the whole pattern of this. We have seen little pockets of positive that then kind of settle down. And we've seen also community transmission. So over this next 1 to 2 weeks, we'll have more information regarding what this particular case leads to, but there is no written understanding of exactly how it's going to be spread at this time.
I think, and I can share perhaps, you know, our community, Fairbanks, has been extremely supportive of sports, and we had lots of families write into the school board and really encourage the board to continue with sports this fall. And so I think this is an important data point for us, you know, something that we need to track and monitor. I think one of the questions was, you know, do we anticipate shutting down football or other sports this fall? As of right now, no, we're monitoring this on a daily basis. And our teams have actually been good about following those protocols and you know, all of the safety precautions and following OSAG guidelines. So it's a balance between, you know, wanting kids to be engaged in activities and engaged in sports, especially in a time where we're not in school to the degree possible. And I think just balancing that with, again, sort of the larger public health picture. We know and take very seriously as a school district our impact that we have on the public health of the community. We have, again, 13,500 students. We have over 2,000 staff. And so if we can keep our school community safe, then we know that will have a positive impact on Fairbanks and, the interior as a whole. So that's our goal. And if we start to see a spike in cases, whether it's related to sports or if we are able to get to the place where we bring students back into buildings, then we'll respond to those as necessary, whether it be like in this particular case, a case-by-case basis, team-by-team basis, if we're able to get kids back into schools, school-by-school basis, or, in coordination with our medical advisory committee, if it needs to be a wider spread response, maybe across the district. So we've been planning the entire time to be ready for movement in and out of the red zone, right? And so just watching those case rates in the interior, taking into consideration lots of other factors that we need to track in terms of, capacity of hospital beds, testing capacity, things like that. And so we've been on paper, we've been preparing for situations like this, and so we'll just have to implement our plans and move through it step by step. So I see a question that came through from Amanda Bowman. Are the entire football teams in quarantine or only those players who were near the player or tested positive? So at this time, both football teams, the entire teams and their coaching staffs and anybody directly involved, on the line of scrimmage is in quarantine. And then we are working with public health and on the contact tracing pieces of that. If it's determined by public health that some students perhaps do not need to be in a 14-day quarantine, public health will let us know that, and then we'll contact those families. So. And let's see, another question. Will there be a change to testing before activities? Will students be tested before each game? At this point in time, we do not have plans to require testing before each game. And Dr. Nace, do you want to talk about just testing in general in Fairbanks and your recommendations around that?
Sure. We know that as a community, the most meaningful way to decrease and control this virus is by quick, accurate testing and contact tracing. Both of those require resources and have to be spread across different sites. And we do not have the ability to test that number of people and get back quick results to be able to fill that gap. So testing before a game would require testing that came back right away, and it would require enough of the testing equipment, reagents, and that is not something that would be possible at this stage, given the number of cases in the United States and the way in which the testing equipment is allocated.
Okay, I see another question. Is this the first school athlete in the state who has confirmed COVID positive since school started? And my understanding is that the answer is no. I believe there was a student athlete in Nome who was identified. And I believe that was earlier in August. And so I don't know the details on that, but that's my understanding. So, and then also from Amanda, what happens if we hit an average of 10 cases? So Amanda's probably referring to our risk decision-making matrix, which is on the school district website, and following the model that DHSS has provided, case rates, 7-day case rates of 10 per 100,000 people over a 7-day period puts us into the red zone in terms of case rates. And so our medical advisory committee tracks that and is looking at that. We actually, again, when we met yesterday, we had just popped over that 10. I think we were at 10.4 was our 7-day case rate average yesterday. Today it's 10.1. And then we make the determination operationally as a school district what zone we want to be in and we feel like we should be in. So again, we talk about testing capacity, we talk about hospital bed capacity, we talk about what the medical community is seeing with regard to cases in Fairbanks. And so the recommendation of that committee yesterday was that we remain operationally in the yellow zone. Again, right now without students in schools, there's not a huge impact to families. If we were to move as a district into the red zone and we had students in school, of course, that would have some pretty significant significant implications. Right now, sports are students that are engaged. And so the red zone does have implications. If we move operationally into the red zone, there are some implications with regard to sports. And Dr. Nace, do you want to add anything else in terms of just considerations for moving into the red zone?
Yeah, I think the DHSS website, where they have the different zones, is incredibly helpful. Just keeping in mind, it's one piece of the decision-making material. So just because it goes from 9.8 to 10.1, it doesn't necessarily mean it's going to change the whole picture. It's one more tool the school district and the medical team has to use to be able to use to help make the decision to help keep the children and the community safe.
Thanks, and it sounds like Scott Gross has some questions. Scott?
Yes, I do. Thanks for taking my questions. I guess I'm going to focus on how did this happen. First of all, are you able to name what team this player is on? And were these players tested before the game as far as temperatures? It looks like it was a pretty quick turnaround to get this test positive. So if he played on Saturday and the parents had him tested, did they get a result quickly back on Sunday or Monday morning? I guess I'm just trying to figure out how this all happened. It sounds like this player maybe did not know that they were positive and played anyway, but I'm just trying to figure out the protocol as to how the player got on the field in the first place.
Right, so I can't speak to the specifics about the student. Again, what I can tell you is that the family contacted us Monday afternoon and indicated that their child had tested positive. And the information we're releasing at this time is that it was a student that was at that game, game between West Valley and Lathrop High School. So that's what we have for right now.
So do you know if this player was tested before he even played and then the result came after?
I actually don't know the answer to that.
Scott, I can give you a scenario. If you're getting tested at the state lab, currently it takes about 2 to 3 days currently where we are to get results back. And that's if it went to the state lab. If you go to, there are some various clinics who do have the rapid testing, which can give you the result back in the same day. And so what information is not readily available, whether the student had a rapid test or whether there was a test that was taken before, I am not aware of.
Okay, and let's see, are there other questions? I don't see any in the chat. Anybody else has any questions, let me know. Is there, from Jordan, is there a threshold for the number of positive cases of student athletes before a certain sport or sports altogether are canceled, even if in the moderate zone within the borough? So we don't have a specific threshold established for that. Again, really trying to take it on a case-by-case, situation-by-situation basis. That being said, we have a limited number of high schools in, with football teams specifically. And so, the ability to compete with one another, is certainly at some point, if multiple teams or more teams were to become impacted, we might consider that we just need to shut down football. Again, there could be lots of reasons that play into that, but if teams don't have the opportunity to compete with one another, that would certainly be a factor. So we also have other sports in process this right now, for fall, and volleyball is one of them, cross country running, and so far, again, those sports are functioning well. We haven't had any positive cases, and we actually have lots of staff at events monitoring. So for example, we had a cross-country meet this weekend, and we have some very, some specific feedback to give to coaches and teams, just to be sure that, at those events where multiple teams are coming together, that we're following all the safety protocols required. So. Another question from Dan Bross. Let's see, are student athletes health screened and asked how they're feeling or temperature taken daily? So maybe I'll have Luke answer this. We have some really specific guidance that we follow. Again, it's OSA guidance, and he can talk specifically to what happens with each team each day at practice.
Yeah, that's an excellent question. So as our student athletes are taking the field, they are asked a series of questions every day, along with taking a temperature screening. So we did have that temperature screening in place. As visiting teams are coming to our facilities, they also follow that same process. So this weekend, there was a tournament over at West Valley, and as all of the student athletes were coming into the facility, they were filling out the same health screening questions and getting their temperatures taken as well. That will also be in place for spectators as we move forward for indoor activities. So spectators will also need to go through those health screening questions for indoor activities.
And then maybe just to add to that, specifically for football in this case, we've also determined the capacity, again, based on social distancing requirements of each of our stadiums, and have very limited number of spectators that are able to be at each game. Any other questions? Did the player play a significant amount of time? Football in Fairbanks, players play a lot. So that's, yes, they did have a significant amount of playing time, and that's not unusual for our players. We have many players who play both offense and defense, and do have a lot of time on the field. So, intermixing, with students from the other team and of course their own team as well. Does this show, from Scott Gross, does this show how tricky the virus is? That's actually a phrase I've heard Dr. Nace use many times, so maybe you can speak to that.
Yeah, so yes, that is sometimes when someone becomes positive in a setting that might have had exposure to a group, the mentality can be to want to assign blame or to that particular person. And the way we look at it is this is a virus. This is a virus who's tricky, and we don't fully, we're just getting to know this virus. And so we know that it can be transmitted before you're symptomatic. We know that it can be transmitted while you're symptomatic and during the illness. And so, yes, this virus is tricky, and making the decision as we balance getting those kids back into school and athletics with keeping healthy is not an easy task. And we know we cannot bring the risk down to zero. What we can do is mitigate the risk by taking the precautions that have been laid out for these kids. And by taking the precautions as a community, we implore still to work with washing your hands, maintaining social distancing, wearing that mask, and cleaning high touch areas. As a community, if we are able to do these and keep our community rate down, that keeps these kids safer and allows them to get back to school, which makes our community safer as well.
Okay, another question about the symptoms that the athlete had after the game. Again, I can't really send any information about that specific to this athlete. And I'm not seeing any other questions. Anybody else has anything? Well, I just want to thank everybody. Appreciate, again, greatly appreciate the Fairbanks community, so supportive of our schools and our district. And again, our families have been very supportive of sports and encouraging us to hold sports and to do it safely, because we recognize how important it is for kids to move and be active and involved, and especially again as a district while we're in a remote learning status. If we're able to run sports and do it safely and keep our community healthy, we want to do that. That being said, we will monitor this situation and keep very close track of all our sports and continue to be sure that our staff and student athletes and encourage our families all to use all the safety protocols that are required, not only by the district, but also by OSSA. And so, there's good reasons for those. And again, if we follow those, if we stay healthy as a district, if we stay healthy as a community, we hope, again, that we can continue with sports, and we hope that we can get to the place where we can bring students into buildings and into schools. So we'll just take this one step at a time and work through this together. So just thank you, everybody, for your support. And I think that's it. Dr. Nates, any final words for just the community in general and from a public health perspective?
From a public health perspective, the thing that I'd add is that cooperation with contact tracing. If you are contacted to get that information, the more information you are able to give them and get back in a timely fashion helps us keep on top of this concern in a way in which can help others.
Okay. Well, great. Thanks, everybody. And that will conclude this press conference.